News will have a full report on that study set to air on Strictly Security on Saturday at 8 p.m. Eastern Time. But for more, we're joined by John Huber, a clinical forensic psychologist and chairman of Mainstream Mental Health. And John, what's your take on the possibility of MDMA helping people with post-traumatic stress?
Well, I think it's a very positive thing. At this point, you know, I like to see my patients get better, and if this is something that benefits them, I think we should be using it. And it's not something we just give them a pill and walk away. We actually give them the MDMA and then give them therapy while they're experiencing the effects of that medication.
Is there something about the makeup of MDMA that matches particularly for the part of the brain that is damaged in post-traumatic stress disorder cases?
Well, MDMA is essentially a hallucinogen, and there's similar studies being done right now also with ketamine, and that also creates that. So I think the triggers are opening up somebody's perceptions, opening up their ability to actually communicate some of their fears that they can't otherwise talk about. They hide from themselves even. And when they're on this medication, they're able to walk through that with a therapist and process that. And they have significant gains in 5 to 6 treatments can be virtually total remission.
Are there specific challenges to people who have post-traumatic stress disorder in the world of psychological challenges and psychiatric challenges that you and other experts face?
It is very challenging because everybody's trauma is different. And PTSD, post-traumatic stress disorder, is not all about being exposed to wartime trauma. It can happen if you've been sexually abused, if you've been a victim of a horrendous car accident, those types of things. So every patient you get has different triggers and different needs. And this type of a treatment could allow us and give us the luxury of not having to weed through every single step of the way for that individual and help multiple patients in a short amount of time.
Clinical forensic psychologist John Huber. John, thanks so much for doing this. We appreciate it.
Thank you.
You got it.